So we'll wait for a few more people to join us so that we can start this session. Okay, hello everyone. Welcome to the next session of this COVID Talks with Dr. Sid. Today we are going to discuss a very, very important topic. The topic is everyone in the entire world has been discussing about COVID-19 infections in adults, but nobody has really, focused much on the COVID-19 infections in children. So today we are going to focus on that topic of COVID-19 infections in children. So we have a special guest with us today. Her name is Dr. Naga Sravani. She's a consultant developmental pediatrician and she's one of the co-directors of Vistara Child Developmental Center, which is in Chennai and Hyderabad. So I would like to welcome Dr. Sravani so that we can start this session straight away. Yeah, so I welcome Dr. J. Nagasawani, who is one of the leading pediatricians in Hyderabad, and she's here today to talk to us about COVID-19 infections in children. Thanks a lot, Dr. Sawani, for making your time in the busy schedule to spend some time with us.
Thank you so much, Dr. Siddharth. It's a pleasure to be on this
Yeah,
platform.
yeah. So, Dr. Sravani, can you kindly tell us about this developmental pediatrics because it's a new branch in India, and a lot of people don't know what developmental pediatrics is. So, can you kindly talk us through what developmental pediatrics is, and can you just tell us what you do at Vistara Child Developmental Center?
So basically, what child development is, it encompasses the sequence of events that changes that happen in a child, physical, let it be in language and emotional, in thought process and thinking process. So all these changes in one under one roof. So we
Okay.
help you to monitor these changes. So why are these important is this is what helps the child from becoming dependent on a parent or a primary caregiver to becoming completely independent when he becomes like
Yep.
adult.
Yep.
So you require all these like small skill sets like over these years to become like completely independent later on.
Okay.
So where we come into picture is we help you to monitor this,
Yes.
and any small delay, any small skill set that the child is having difficulty in or deficient in.
Yep.
So we try to identify it early and try to
Okay.
tackle it so that the results are much better. Why
Okay.
we want to identify it early is because 95% of the brain development occurs in the first 5 years of age.
Okay.
So that's the reason that we want to, identify before this and start the structured therapy as soon as possible so that it's much easier for the child to cope up later on.
Yeah.
So what it involves is all these disorders like autism, hyperactivity, inattention, learning issues, speech delay, or difficulty in speaking like stammering,
Yep.
stuttering,
Yep.
and the list goes on and on.
Yes. Yes.
So we deal with all these things.
It's an interesting topic because in India, I'm sure the focus is not much on developmental pediatrics. So I hope you make a change in this field, and I wish you all the best in the future. So let's get on with the current topic today. So our topic today is
Yes.
COVID-19 in children. So I've collected a lot of questions online by all the followers of the groups. But we will try to answer most of those questions. But if time permits, probably we will answer some live questions as well. So, Dr. Sharoni, the first question is we all know that the adults are anyways affected with this COVID-19 infection, and we are in the national lockdown at present. My question is, can children be affected with COVID-19 and how common it is?
Yes, children can be affected. COVID-19 till now, it can affect from a child who is just newborn baby till, as we all know, an old person too.
Yes, yes.
Uh, but it is not as common as it's seen in adults.
Okay.
Till now, like in the first wave, the percentage of reported cases seen in children was around 13%.
Okay.
Now in the second wave, it's around 22%.
Okay.
Like in the total reported cases, the percentage of them being children.
Okay.
And
So,
amongst these, like mostly till 70% also they're asymptomatic. That means
okay.
they don't have any symptoms.
Okay.
And like only 5% require any hospitalization.
Okay.
And the rest of them, it's only like mild symptoms where you can handle them at home.
Yeah. So you're
So
saying
that's the
that
reason it's,
the second wave, there has been an increased number of cases, but still, compared to adults, the children are less affected. Is that what you're saying?
yes,
Okay.
that's
Yeah.
right.
That's interesting. So, what are the symptoms in COVID-19 in children?
So the symptoms in COVID-19, we usually divide them into like the mild category and the moderate and severe category.
Yes.
So first we'll discuss about the mild category where you can deal with these symptoms at home.
Yep.
So usually they present with fever, any throat pain, cold, mild cough, mild stomach pain,
Yep.
loose motions, vomitings.
Yep.
So things like this. So all these things in the mild category, like you can handle them at home.
Yep.
So coming to the moderate and severe, any difficulty in breathing,
Yep.
increased respiratory efforts,
Okay.
the child, like there's any bluish discoloration of, the fingers and toes. There is a continuous high grade temperature, like more than 1 or 2, beyond 5 days. And the child is dull, not accepting any oral feeds.
Yep.
He's inactive,
Yep.
he's sleeping a lot, or any things like this, they all come into the severe category.
Okay, okay. Yeah, so it's actually kind of pretty similar to what we see in adults as well, the mild, moderate, and severe. So yeah, that's interesting. But as we all know, that children are very, very commonly affected with common cold, these common flu, influenza virus, and other these common infections. Is there any way where we can differentiate that the child is suffering from COVID or any common cold?
It's a very valid question.
Yeah.
Frankly speaking, it's very difficult for even
Yep.
a professional to identify the difference just basis on the symptoms. Is it
Yes.
COVID or is it just a common cold or
Yes.
a flu
Yes.
or something like that?
Yes.
So taking into consideration the pandemic, it is better for us to think until otherwise proven that any of these symptoms has to be taken as COVID symptoms
Yep.
till we get the test report.
Yes. Yes.
So it
So
is better we treat it as COVID.
So better err on the caution that if the child is having fever or cold or cough, rather than just brushing it off that it's a common cold, we have to think whether that it can be COVID as well. So that's a good
Yes.
explanation, given that it's very difficult to differentiate between common cold and COVID. So yeah. So the next question is this. I think you've already answered this. That if the child is COVID positive and he has, yeah, what kind of symptoms can be managed at home, and what kind of symptoms need hospitalization?
Yeah. So as I already told, any like fever just around 100 to 101,
Yes.
which is lasting less than 3 days,
Okay.
and cold, mild cough, which
Yep.
is not resulting any breathing difficulty or
Yeah.
fall in the saturations,
Yeah.
any loose motions, mild loose motion like less than 10 per day,
Okay.
and just 1 to 2 episodes of vomiting and things like this. But otherwise, the child is active, he's eating well, he's playful, and
Okay.
there's no difficulty in breathing. You
Okay.
can manage them at home.
Okay. Is there any the pulse oximetry readings? Is there any difference between the adults? Like, can we monitor the pulse oximeter readings for children as well at home? And how much is the cutoff?
Yes, you can monitor the pulse oximeter readings in children, but the only issue what comes is like I just want to show like this is a
Yeah.
pulse oximeter. So how do you use it? You switch it on first,
Yes.
and then you wait for the numbers to come.
Yes.
So once they come, then you insert your finger. The light should be on, and then you
Yeah.
insert the finger.
Yes.
And then you wait for the waveform to come.
Yes.
If you can see, the waveform is what is important.
Yes.
Like till then, you need to wait.
Yes.
Sometimes it gives like spurious readings, which
Yeah.
is not correct,
Okay.
like what's happening right now.
Okay.
Like because the waveform is not right, so we have to wait till a proper wave comes and then
Okay.
take the reading. And the
Okay.
second thing, what difficulty that we find in children is this is an adult probe. That's
Yes.
what is available commonly.
Yes. Yes.
Child probe is not available
Okay.
for home. It's only
Okay.
available in hospitals.
Okay.
So what you have to do is, because children's fingers will be smaller, use a
Yes.
thumb. Use the
Okay.
thumb of the
Okay.
child, or you can even use the great toe.
Okay.
The feet you can use. So
Yes.
whichever, finger is actually fitting into it correctly, and
Yes.
then you can just hold it, like press it a little bit so that it
Okay.
snugly fits, and then wait for the reading.
Okay.
And usually just a saturation of less than 95, don't get panicked.
Yeah.
With that, you again repeat it. With that, see if the child is having any difficulty in breathing.
Yep.
Is the child dull? Is there increased respiratory efforts?
Yes.
And associated things also. And
Yeah.
if anything like that is there, immediately take the child to the hospital.
Oh, that, yeah. So those are the danger signs where you take the child to the hospital. Like if the child is having very difficulty in breathing, if the child is not active, not accepting feeds, the child is quite dull, and you've noticed that the saturation is dropping below 95 or 94, then those are the danger signs where you need to hospitalize the child. Is that right?
Yes, yes.
Okay.
So
Okay.
till then you can manage at home. You have to
Yeah.
check the temperature like every 6 hourly. If
Yep.
it is more than 100.4, give the child paracetamol, the
Yep.
dose that your pediatrician has prescribed.
Okay.
Check for the saturations. If it is less than 95, monitor and then inform your pediatrician, or it's less than 95 with other symptoms, rush to the hospital.
Right.
Any
Right.
increased respiratory efforts, any change in the activity, like he's
Okay.
becoming dull, lethargic, not eating, anything
Yep.
like this, decrease in the number of times he's passing urine,
Okay.
his hands and feet are becoming cold or blue, anything like that. So
Yep.
these are things that you have to monitor at home. So any of these things that you find, it's better to take to the hospital.
Yep. That explains most of it. There's one more commonly question. One of the most common questions asked for me is if what are the if there's a newborn baby at home, what are the precautions we need to take to prevent the newborn baby to be infected with COVID?
Okay. So in this, there are two scenarios. One,
Okay.
being mother is COVID negative and there's no other COVID positive person at home.
Yep.
So what you can do is, as we usually what we do, a newborn baby, we're all very happy and we want to, the grandparents want to come and meet, the uncle and aunt, they all want to come and meet. But try to avoid this. Try
Okay.
to avoid physical contact as much as possible. Let there
Okay.
be a primary caregiver, that is a mother, and one or two more people who can help her out. So
Okay.
more than this, don't like reduce the number of people who come in contact with the baby.
Okay. Yeah. Yeah.
And next thing is, before handling the baby, make sure that you wash your hands
Yeah.
at least for 20 seconds
Yeah.
properly. Or if it's not possible, at least use a hand rub, which is like more than 70% of alcohol content.
Yep. Yep.
And if anyone has any mild symptoms of a cold or sneezing or fever or anything like that, make sure you isolate that person. They don't come near the baby, and
Okay.
so that you reduce the transmission.
Yeah, so it holds good even in adults as well, that social distancing, unnecessary contacts, unnecessary exposure is not recommended like in children as well. Yeah, so that answers that question.
Yes.
There's one more raging question, which is, more than 50% have asked this question to me, that if a pregnant woman is COVID infected, can the baby be infected as well from the mother in pregnancy?
Yeah, this is a very valid question.
Yeah,
So the studies still, they're not concrete, like large amount of studies still,
yeah,
but till now in the few studies we have found that there is 3.5% chances of it coming from, vertical
Yeah.
transmission from the mother to the baby.
Yes.
But more than that, they have noticed like postpartum, like after delivery, transmission is even more than
Okay.
in utero transmission.
Okay.
So that's the reason that if at all its mother is COVID positive, so after delivery, like make sure that you maintain, like they said, when mother is feeding the baby, mother should have double mask and wash her hands properly before handling the baby. And
Okay.
some other person who is young and doesn't have any comorbidities and COVID negative, handle the baby till mother is,
Yeah.
becomes better,
Yeah.
so that you reduce transmission to the baby.
Okay. There's one question asked that there was a case where the mother was negative but the baby was positive. Is that possible?
Yeah, it is actually very, very rare because the
Mm.
amount of like the close proximity that a child and mother have. But then there are other scenarios where the mother may have already developed antibodies, so that's the
Okay.
reason that she's negative and the
Oh,
baby
okay.
can be
Yeah.
positive.
Yeah.
So in rare scenarios, this has been seen where, the mother is negative and the baby being positive.
Okay. Yeah. So that answers that as well. The next, again, the second most common question is what precautions are to be taken is breastfeeding, and can breastfeeding transmit the COVID virus from the mother to the baby?
No, so till now, breastfeeding is not contraindicated in a COVID positive mother.
Okay.
Breastfeeding is recommended
Okay.
because the advantages and the benefit that you get from breastfeeding is much, much, much more than the slim chances of
Okay.
the infection being transmitted, because more than the infection, the antibodies will be transmitted usually.
Okay. Yeah.
So the studies still haven't proven that it transmits like significantly through breastfeed.
Okay.
So that's the reason that breastfeeding should be continued,
Okay.
if even though the mother is COVID positive.
Yeah.
If the mother is unwell, she has to be hospitalized or things like that. If it is possible, she can express the breast milk and someone else can feed the baby.
Yeah. Yeah.
Or if that's also not possible, then obviously then we have to see other
Yeah.
modes.
So the most important take-home message here is please do not stop breastfeeding if you're COVID positive to your newborn, because you will be doing more harm than good if you stop breastfeeding. And breastfeeding is recommended.
Yes.
There is no rule against breastfeeding in COVID positive mothers. So yeah, that should be the take-home message in this session. So what are the general precautions a COVID positive mother can take of a child? It may be a newborn or a proper child. For example, the mother and father both are positive, and there's the child who's less than 5 years at home. What are the general do's and don'ts? What you recommend to the parents?
So first thing is obviously test the child.
Yeah.
So if by chance, luckily the child has come negative, so you have couple of options. One is if you have some other caregiver whom the child is close to and can handle the child,
Yeah.
is comfortable with them. So please let that person take care of the child rather than the parents,
Okay.
and maintain the the distance and let the parents be isolated.
Okay.
No, it is not at all possible. There's no other relative or any other caregiver. Then at least be in a place where it's well ventilated. It should
Okay.
not be a closed room that they're all
Yeah.
together.
Okay.
It should be a well ventilated room. Make sure that they wear double masking when they're there around the child in the same room, and they follow like hand washing
Yeah.
and separate utensils
Okay.
for like when they're eating. So if you do these things, at least you can try to minimize as much as possible
Okay.
the
Yeah.
transmission to the child.
Okay. Okay, that's a pretty thorough explanation of what's to be done. There's one more question which was being asked. So, in which group of children we can expect a very serious infection? Are there any specific groups of children where they are highly susceptible to severe COVID-19 infection?
Yes. So children who already have pre-existing diseases like any cancers or congenital heart diseases or any chronic kidney diseases or asthma or any other illness which required long-term use of steroid like nephrotic syndrome or
Okay,
immunosuppressants. So
okay,
all these children, there are more high chances of the disease to become severe. So
Okay.
what we recommend is, if the parents are not able to monitor properly at home,
Yeah.
it is better even with mild symptoms to be admitted in the hospital just for monitoring,
Okay.
because there are more chances of them developing a severe
Yeah.
infection.
So the summary can be that children with chronic illnesses are more susceptible for severe infections, and please do not neglect if the child has even mild to moderate symptoms, because they can get severe, especially in children with chronic diseases. Yeah, so that explains
Yes.
that bit. So the another common question which is being asked is there any studies, or is there any evidence of, or is there any research going on COVID-19 vaccination in children?
Yes, it has already started. Uh, like Pfizer in US, it's already been approved for children about 12 years of age.
Okay.
They have been given the approval to vaccinate all children about 12 years of age.
Yep.
And in India, Covaxin, that is Bharat Biotech one,
Yep.
has been given approval for going to phase 2 and phase 3 trials from
Okay.
in children between 2 to 18 years of age. So
Okay.
they have already, it's been a couple of days since they have started the trials.
Okay.
So all these things are the positive things that
Yeah.
hopefully pretty soon in the next
Yes.
1 year
Yes.
or so we may expect the vaccination for children too.
Children, as of now, you're saying that it's only about 12 years. So there's no research
Yes.
going on in below 12 years.
No, the research is going on, but it's
Okay.
still not approved.
Approved yet.
The
Okay.
trials are
Yeah.
still going on.
Okay.
Like
Okay.
Pfizer and Moderna are doing like 6 months to 12 years children right now, and
Okay.
Covaxin from Bharat Biotech, they started from 2 years to 18 years of age. They've
Okay.
started the trials,
Okay.
and they're also doing trials for the nasal vaccine.
Okay.
So if it is efficacious or no.
Okay.
So
That's
all these
interesting.
trials are
Yeah.
underway.
Okay. That's interesting. So another question is the third wave, which the entire world is awaiting or dreading. So, uh, coming to children wise, do you think that the third wave will affect more children than what it has been affecting in the first two waves? If at all the third wave comes, God forbid the third wave doesn't come, but if at all there is a chance of third wave coming, do you think that the children will be more affected than what they're being affected now?
So what the experts, this is the major discussion that's happening right now in
Yep.
all the higher officials, the government, the healthcare officials,
Yep.
everywhere. These are the discussions that are happening.
Yes.
The main reason why they are anticipating that the third wave may affect children more is because the first wave, as we all know, affected the senior citizens more, like
Yeah.
the people above 45 years of age with comorbidities like diabetes, hypertension, or any
Yes,
long-standing disease.
yes, yes,
And the second wave has affected them, and it's also affected the 25 to 35 years
yes, yes.
of
The
age
young adults,
population
yeah,
too.
yeah,
Yeah, so the young adults have also been affected more more so than the first wave.
yeah,
So that's one of the reasons that they're predicting, maybe, if the way the COVID virus is mutating, it's
yeah.
always trying to uh, identify the most vulnerable population.
Okay.
So next who are left is the children. So that's the reason that it may
So
affect the children more,
there
is
is a
what they're
prediction that
saying.
it might affect children.
Yeah.
Yeah,
And one more reason is because now above 18 years of age, hopefully we'll all be vaccinated in
yeah.
coming, few months, like at least by 6 months, hopefully all of us, all above 18 years people will be
Yes,
vaccinated.
yes,
So
yes.
the only people who are not vaccinated is from 0 to 18 years of age.
Exactly. Yeah.
So they'll be the vulnerable population then, because obviously because of all these reasons. So that's the reason that they are predicting that there are high chances that children may be affected more.
Okay.
But that being said, it is just a prediction.
Just
So
a
it can
speculation,
be,
probably. Yeah, it can or cannot happen. Yeah,
yeah, it can or cannot happen. So rather than be panicking about it and thinking, no, 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 what's going to happen? Like, kids are going to get affected. What are we going to do? Rather
yeah,
than all that, let's prepare together. If at all it happens, what can we do?
yeah,
So already, a lot of states have made task forces to identify what they can do to prepare for third wave, because we
yeah.
don't want to be like taken off guard, like how it happened in
Exactly.
second wave,
Yes,
where
yes, yes,
we were
yes.
not prepared for it.
Yeah.
So at least the government, like a lot of states, have already made a task force. They've already identified people to be part of it, and they're taking their advice and they're trying to do things
Yeah.
to be prepared for the third wave if at all the children are going to be more affected. So
Yeah.
that being said, what we can do as parents, what we can do. So the only things that have helped us in preventing the infection from day one, like
Yeah.
from this first wave to second wave and it's going on, are like, social distancing,
Mm.
wearing mask,
Yeah.
hand washing, cough and sneeze etiquette. And
Yeah.
these are the main things which are in our hands and which have been like consistently helping us prevent
Yes.
the
Yes.
transmission of infection.
Yes.
So rather than thinking about what is going to happen, if we continue, even after the lockdown is lifted, even after the second wave plateaus and starts coming down,
Yeah.
we have to be extra careful
Yeah.
about these things. Like we continue to do these things for the next year or so
Yeah.
till we are sure about there's not going to be a third wave.
Yeah.
And one more important thing is make sure all parents get vaccinated. So
Yeah. That's the most
why
important
I'm
thing.
saying
Yes.
this, yeah, why I'm saying this is from where do kids get infection?
Yeah.
Because they're not going to schools, they're not having any other, you know,
Activities or whatever. Yeah.
play group activities or anything. So the main place where they get infection is from the adults. So if the
Yeah.
adults are vaccinated, they can't transfer the disease to the children.
Perfect. Perfect.
So
Yeah.
these are few of the ways that we can protect our younger ones and make sure we prevent the third wave from happening.
Yeah, excellent. That's an excellent explanation, Dr. Sravani. Yeah, the take-home messages are as simple as that. It is not complicated. It is not rocket science. So please stay at home. All of you above 18, please get vaccinated. Follow social distancing norms. Wash your hands. Wear a mask. So these have been reinforced and by many of the professionals as well as the leaders. Please follow whatever is being told. And yes, there is an age-old saying that prevention is better than cure. So yes, if we prevent, we need not be cured. So that's very, very important. And I would like to thank Dr. Sravani again for taking her time out to be with us in this forum where she actually cleared a lot of doubts about COVID-19 in children. This video will be on IGTV on my profile and Dr. Shravani's profile as well. So whoever have missed this can see it again and learn the myths, the facts about how COVID-19 affects children and what can be done. So I would like to thank you again, Dr. Sravani, for coming to this session and educating us all about pediatrics. Thank you so much.
Thank you. It's really a
Yeah,
pleasure to be here and
yeah,
thank you.
yeah. So thank you guys. Thank you for joining, and I will be conducting these sessions regularly, inviting new experts into my sessions from now on. So stay tuned and stay safe at home. All the best. Yeah. Bye.